Hello, I am Urologist Ömür Erdem Akkaya. Today I will have a short video presentation on what is hypogonadism, what are the drugs and preparations related to hypogonadism, and what is the optimal testosterone level. The information I give in this video is not for therapeutic purposes. I definitely do not recommend doing it without a doctor's control. It is for informational purposes only. What is hypogonadism? Hypogonadism is a group of complaints caused by disorders of the pituitary gland, disorders in sex hormones and their symptoms, and related problems. There is an ax released from the pituitary gland in all men. Complaints and problems occur in the patient in the deterioration of this ax. What should be the optimum testosterone level? This is a value that is still discussed, but in our guidelines today. I am talking about total testosterone, which should be between 300 nanograms and 1000 nanograms. Now there is actually quite a range between 300 and 1000. While we do not see any complaints below 300 in patients, we can see complaints in 400. Here, when the total testosterone of the patient is 400, it does not mean that the patient will not have any complaints. When we increase testosterone, the complaints can be completely cured. The most important thing here is the patient's clinical condition. Not only total testosterone but also sex hormone-binding globin, goiter tests, FSH, LH, and other hormones are important for the patient. There is also a parameter here we call bioactive testosterone. It is important to measure the bioactive testosterone in the body and act accordingly by calculating free testosterone and sex hormone-binding globin. But you don't always have such an opportunity. If the patient has complaints of normal total testosterone, it is recommended to check free testosterone. The optimum testosterone level recommended is actually 600 nanograms per deciliter. About my own clinical experience, I get patients to have testosterone checked daily, but the number of patients catching 600 is once a month. Apart from that, it's below 300-500 for those who have complaints, unfortunately. I also saw patients with testosterone levels in the 600s and 700s, who still have sexual problems, such as erectile dysfunction. It is not related to the total testosterone level of the patient. Also, psychological mode and communication with the partner are also very important. I think psychological reasons override organic reasons from time to time. These also need to be evaluated very well in patients. Our topic today is testosterone. What are the drugs and products used to increase testosterone? The product we use the most in this regard is testosterone itself, natural testosterone. In Turkey, there are 3 legally testosterone preparations. One is Sustanon, the second is Nebido, and the third is Testogel. Testogel recently arrived in Turkey. There wasn't for a long period. There are 3 types of testosterone esters in Sustanon. Short, medium, and long-acting. What are its advantages? It is done once a month and is cheap. What are the disadvantages? It is applied as an injection, the injection is painful and it causes severe testosterone fluctuations in the blood. The drug we call Nebido also contains testosterone, natural testosterone. It has undecanoate ester in. It is long-acting and is produced in a quarterly form. It is expensive. It is made in injection form. It may cause slight pain at the injection area. There is also Testogel. It is a gel form as obvious in its name. It is applied every day. The biggest advantage is that there is no injection and the testosterone dose does not fluctuate in the blood. There are 30 units in a pack and the patient rubs it on a hairless area every day. The disadvantage of testosterone products is that they slow down or stop sperm production and shrink the testicles. Apart from that, there is no deterioration of sperm quality or shrinkage of testicles in the products we use. What are these? SERMs, selective estrogen receptor modulators. These are products like Clomiphene, Arimidex, Tamoxifen. At the same time, human chorionic gonadotropin, HCG, formerly known as Pregnil, is a product that is named Choriomon. There is no change in sperm quality and testicle size in these products, there are no such side effects. When it comes to SERMs are actually old drugs. Clomiphene produced in 1960 and arrived in Turkey in 1984, it has been used for infertility in both women and men for over 30 years. It has long-term studies for hypogonadism such as 3-year study, and it is one of the products with proven reliability. It is cheap. It increases the testosterone levels from 300s to 600 to 700s in a month. It does not have a serious effect on estrogen. It also increases estrogen, but in my experience, I have never had to modulate a patient's estrogen due to the treatment. There are aromatase inhibitors, I do not use them in the routine clinic. I only use it if estrogen rises. Products that are used to increase testosterone and suppress estrogen in estrogen increase. These have long-term studies as well. But about Arimidex, many publications have shown that it creates a serious decrease in HDL in men, creates a depressive mood. It is necessary to pay attention to this. Other than that, there is human chorionic gonadotropin, HCG. HCG is also used as an injection. You need to inject 5,000 units per week. When you use it, it seriously increases testosterone, creates the LH effect, and also increases estrogen. In order to suppress estrogen, you may need to reduce the dose when necessary or reuse the aromatase inhibitor. Frankly, this is reliable according to the studies on hypogonadism. There are even studies using HCG with testosterone. When you give both testosterone and HCG, the testicles do not shrink. This is also an advantage in patients with hypogonadism. Apart from that, these are the most used products to increase testosterone. But my suggestion is that the patient can always manage to keep testosterone at a certain level by paying attention to his nutrition, sleep, exercise, psychological mode, and relationship with his sexual partner, without condemning himself to these products. Because as I said, I think testosterone is not always the most important thing in sexual life and male health. There are also SARMs. SARMs are a group of molecules that have been produced in the world in the last 20 years, which have an advanced tissue selectivity to the testosterone, namely the androgen receptor, and currently do not have a legal form in the world. There are about 40 to 50 versions of SARMs. They are constantly increasing, and new molecules come out. But no molecule has ever received an indication for any disease. There are animal-based and cell-based studies. Human studies have been very limited. Their duration is also very limited. It was used in volunteers for around 1 month. It was tested on 20 patients in one study and increased liver function in 2 patients on the 20th day. The other 18 did not have a problem. It has increased muscle tissue. It has provided a reduction in fat tissue. It did not cause any changes in estrogen metabolism. Likewise, in animal studies, its pharmacokinetic effects are very good. I think there may be a molecule that can replace testosterone in the future. But now the FDA has serious warnings about SARMs on its own website. It says they should definitely not be used. In another study on SARMs, 40 taken SARMs were evaluated. However, only 18 of them have SARMs in, and the other 22 have nothing in. And 5 of the remaining 18 have the said amount of substance. In 13, there are fewer or more amounts than said amount. Using SARMs is like drawing a number. You don't know what you'll do or what you'll use. Because the control mechanism is entirely at the mercy of the company that produces it. Since there is no control in the producing company, that day, you get whatever comes out from the cereal, whether it's good or bad. I definitely do not recommend using SARMs as it does not have a control mechanism. I do not recommend it since none of them has long-term studies. Because people use anabolic steroids for 5 years and 10 years. What happens when you use SARMs for years? Only the future will show it to us. But I believe that there will definitely be a better molecule than testosterone among the SARMs for both hypogonadism and infertility. But much more time, much more work is needed. Thanks for listening. Best regards.